Mr. Chairman. Dr. Collins and all of you, we're so glad to see you once again. And we have talked among ourselves under the leadership of Senator Blunt. We would like for the subcommittee to be able to visit NIH so they could talk in more depth and more firsthand to see the great work that's being done by the people who work there. And of course, you know, if you're the senator from Maryland, NIH and Hopkins and University of Maryland. So we're glad to see you, longstanding friends like Dr. Fauci, to new friends. But let me get right to my appropriations question. The president has put in his request a $1 billion increase. I'm going to know what that means, and is that enough? I understand that NIH has lost 20% of its purchasing power since the doubling ended in 2003 due to inflation. I'm concerned that, yes, though you have more than the management capability to set priorities, you're going to have to end up picking winners and losers. Winners and losers in the United States of America. You can't dial up an NIH just because there's a headline or a world crisis. We turn to Dr. Fauci and your leadership during the Ebola crisis, and we've turned so long from AIDS, other issues, and so on. You can't dial up a National Institute of Allergies. We want a cure for Alzheimer's, and we want it yesterday. We all share that, all around this table. But with the resources that you have, I'm concerned. I'm concerned that while we go for precision medicine, which I support, I worry about zip code medicine. The disparity in Baltimore this morning between the neighborhood in which I live, called Roland Park, and a neighborhood called Harlem Park, where they filmed The Wire, about 2 miles from where our disturbances are occurring, is a 22-year life expectancy, even controlling to violence. I'll live to 88 to 92. That dear lady and that church lady is going to make it maybe to 68 to 72. I could go on about it. As you know, that we've got a lot of issues here. Dr. Thornton, our superintendent of education, talked to me about the 85,000 kids that went home fine on Monday, 300 created disturbances, unacceptable. But we talked about how damaged our children is. I said, what do you need in the school system? He said, mental health, mental health, mental health. Either my kids are addicted or their caregiver is addicted. So what is $1 billion going to get you to help America with what all we need to do? I don't want to pick winners and losers between the 26 institutes. What is it that you truly need to do the job you need to do to serve America while we're trying to do ours?
Senator, thank you. And very sobering indeed, the stories that you've just shared about what's happening in Baltimore. And I think all of our hearts are deeply troubled and wish for the best for that fine city. We have seen over the course of the last 12 years a significant diminution in NIH's ability to do research across the board. And our most important resource, the people doing the work, are clearly pretty stressed at the moment. If you try to plot out what the reasons for that are, and I show you a graph up there, the yellow line is basically what our purchasing power is for biomedical research going back to 1993. And you can see there was that doubling between 98 and 2003, but since that time we have steadily lost ground. The sequester added an additional severe blow to our ability to get our work done, taking as it did $1.5 billion away in the middle of a fiscal year, and from which we have not really fully recovered. The $1 billion in the president's budget would go a long way towards putting us back on a stable upward trajectory, and we've waited a long time to be able to achieve that. It would allow us to give 1,200 additional grants in FY16 compared to the previous year, and that would be welcome indeed. It would allow us to do things like the Precision Medicine Initiative, which, as I said earlier, we would very much want to have focused on looking at health disparities with the ability to really not only get answers as to causes, but to come up with implementation plans for interventions.
So the $1 billion would help, but what would lifting the caps do?
Well, certainly, if you look at that diagram, you can see that we are down more than $10 billion over where we would have expected to be if we'd stayed on that dotted green line, which was the trajectory for NIH going back to about 1970. So it's going to take quite a bit to make up that ground. The other thing I might show you is the consequence of that for people who are trying to get their research funded by NIH. That's the success rate. That's what an investigator who's sent their grant into us is facing. And you can see going back a couple of decades, that's traditionally been in the range of 25 to 35%. But more recently, with the flat budgets influenced by inflation, we're down in the zone of 16 to 17%, which is very unhealthy and has caused, I think, a great deal of demoralization.
People don't understand percentages. What is the number?
The number of grants, so 1 out of 6 would be funded at this time. Traditionally,
And how many do you turn away?
that would be 5 out of 6. So about, yeah.
But is it 200? Is it 2,000? What does that mean?
I see where you're going. Okay, so the number of grants that we fund in each year at the present time is about 9,000. So that means we are turning away about 55,000. And you know what? I don't think I can tell the difference between a grant that just made the cut and got funded and one that missed it, because in that zone, they're all terrific. And so we are leaving a lot of great science, maybe half of it, on the table, which we would not have done in past years.
That's a stunning number. Yes. Well, my time is up. I think we've made our point. You need at least a 5% increase to stay in place and to begin to catch up.